What if I told you that where you look can change how you feel? What if the key to breaking free from trauma, addiction, and life blocks was as simple as finding the right spot to gaze? Today we're talking to Judy Holly, a clinical social worker and trauma therapist who's been helping people heal since 2009. She specializes in something called brainspotting. It's a relatively new form of therapy, developed in 2003, and isn't widely known yet. Here's what it looks like. Picture yourself sitting with a therapist, and the therapist uses a pointer to help you find a spot in your visual field. A place that, when you look at it, you feel something intensely, maybe discomfort, tightness in your chest, stomach, or jaw. Then you just stay there. You're not constantly talking. You're processing internally, letting your brain do what it knows how to do, accessing those deep subcortical parts of trauma that get stored and stuck. It can feel intense, emotional, even physical. But as you stay with it, something shifts. The emotional charge begins to release. We're talking about people processing trauma in 3 to 8 sessions instead of years. In this conversation, Judy breaks down the neuroscience behind why brainspotting is so effective, shares incredible stories of transformation, and explains how our brains are way more connected to our bodies than most of us realize. Let's dive in.
My name is Judy Holly. I am a clinical social worker, trauma therapist, and manifestation coach. My background, I actually started in my early 20s taking child psych. I'm ADHD. I didn't know it back then. Dropped out, traveled, hitchhiked across the country, then became a graphic designer. And then eventually found my way back in and loved it so much that I got a college diploma, 3 degrees, including my master's. And I'm trained in multiple modalities. So I really went with it.
Cool. So how long have you been practicing therapy for?
Psychotherapy since 2009, 2011 in my private practice. I started in addiction, so I worked in residential treatment centers. I did a little stint where I was training for my master's in forensics, working with not criminally responsible. Yeah, it was pretty cool, but I never want to do it again.
Yeah.
But nothing anyone tells me will ever shock me. I worked with children and families in different organizations and in schools. I keep going back to working with youth because they're like sponges. They're so capable of change. And I do work with soldiers and just people with trauma in my private practice.
So what made you want to have a focus in brainspotting?
So I actually always intended, because I worked with trauma, to focus on EMDR. EMDR is a very evidence-focused, evidence-based modality where you, often it's like fingers, you watch the movement, you were watching it.
You just got me, I'm like a cat.
Or bilateral stimulation of sound. But basically, it's very, very structured. Yeah. And you are reprocessing trauma memories, usually 6 to 8 sessions, to rewire the brain for wherever the trauma is held. It's kind of based on, I tell people it's based on like how when we're sleeping and our circadian rhythm resets, kind of the same thing where you're processing that. But you're interrupting the person's processing to have them kind of build awareness of where they're at. And I had done EMDR in my own work, so I really was focused on that because it's evidence-based and tried and true. What happened was my daughter was born at 24 weeks, and she was exhibiting signs of trauma when she was about 3 or 4. As a trauma therapist and a mom, I was like, I have to resolve this before it goes too far. But there's nobody that would do EMDR for children. And I found someone in the Ottawa area who would do brainspotting. So I was like, reluctantly, I went to her and one session, and it completely resolved the trauma responses she was having. Wow. And gave her this really crazy dream. So the night that she had it done, she woke up in the morning and she was like, Mom, I had this dream where I was in a crib and I was crying and nobody had come for me. So that fascinated me, but also because it helped resolve her trauma responses, I became really interested in it. So when it came around to me doing more trauma training, Brainspotting was offered and EMDR, and I went with the Brainspotting. Honestly, it was cheaper, and I just kind of fell into it. And then I really expanded. So now I've trained in 3 of the David Grand modules. I'm doing the other one next week, as well as a whole bunch of different side.
I also have used bilateral sounds for focus because I'm ADHD.
Oh, me too.
So whenever I have something like accounting that I have to do, and my ADHD brain goes, no, you're never doing this. We're never touching this.
Right.
Until it's urgent.
Yeah.
But anyway, so I'll put on sounds that will just bounce from ear to ear. And they're just very basic sounds. They're nothing complex, right? Yeah. And for some reason, I just hone right into what I'm doing.
Because, do you want to know why?
Yeah.
Because with ADHD, we need to use 100% of our processing power. Mm-hmm. So if you're doing something that takes like 30%, your brain is going to wander because you're not able to focus on it. But if you're doing something that takes 100%, you're able to kind of hyper-focus. So if you're washing the dishes or doing something that doesn't use all that processing power, the sound will help you focus because it's also using some. So when I was in university, I used to have the TV on and music playing in order to do an essay.
How would you describe brain spotting to someone who's never heard of it and you would know that it would like help them out?
So I'll say David's go-to. David Grand is the founder of it, but it's basically where you look affects how you feel. He was an EMDR therapist who was doing it with a figure skater who had this, I think it was a triple axis jump or something she wasn't able to do because she had a block from some sort of trauma. And he found that when she looked at a certain spot, he would stop his fingers and she was able to process it. So I usually tell the story just because that is the background of it. Okay. But really, our brains are connected to our body. And there's different parts of our brain. So our prefrontal cortex, with ADHD, it's under active. Mm-hmm. But our prefrontal cortex is your thinking brain. It's your adult, it's your speech and language, working memory. So it's where everything kind of gets stored for actual memory. Mm-hmm. And it's also your impulse control. So that part of the brain is executive functioning. And then the back part of the brain is your limbic system, your amygdala, which is your emotion control. That's how it remembers things. It's your subcortical brain. And it's directly connected to your nervous systems through the brainstem. So that's how we kind of survive. It's our survival response. It's fight, flight, freeze, and fawn. And we don't really think about those things on how we're going to, if we're going to cry, we don't really think about it, right? It just happens. So it's our subcortical brain that houses where threats happen and where emotion happens. So with brain spotting, your optic nerve goes into that part of the brain and connects with, I call them wires. People in brain spotting actually call it capsules. I'm an addiction therapist, so I don't talk about capsules. But they find those wires that are attached to whatever emotion, whatever body sensation happened in the trauma. And it can rewire things. I could get into that, but it rewires things basically is what I would tell a new client in order to reprocess wherever you got stuck. Because trauma is not about the story. It's not about this part of the brain. It's about how it made you feel. So people that go to talk therapy for trauma, it will never work because you're activating your prefrontal cortex, you're talking it through. And it just will not work because you need to get into the back part of the brain where it's housed and your nervous systems. So it also, I don't want to get stuck on trauma, but that's what I do. Yes. But it also can activate resource, so help you feel calmer. It can remove any anxiety or grief over a loss or something coming, can help you feel calmer. And it can do this magical thing. It's not magic, it's neuroscience, but it feels magical, where it can like improve on a creativity. Like let's say you're a painter and you really want to paint a picture, but you can't kind of get it right. It can help activate that.
That's so cool.
Yeah.
So when you're in a brain spotting session, what actually happens to the body?
Okay. What happens is, let's say someone would find a spot, but you would find a spot where you would look to find the emotion that you are wanting to clear. So let's say it's anxiety. Let's say I'll take a phobia of spiders. You had this horrible incident where there was a spider like jumping across the water, and that's your memory. We would talk about it, activate you. I would usually pick up on your brain spot, or I would use this wand. I meant to bring it. I didn't bring my wand, sorry. But to kind of find the spot where you would be looking. And then basically you hold that spot, but what's happening is it's activating your subcortical brain. So your hippocampus for your feeling sense, your brain stem and the basal ganglia for whatever's fight, flight, freeze, or fawn, where you got stuck, that's connected to the nervous system. It activates the thalamus for your felt sense. And the really cool thing is the insula, which is your interoception or your intuition. So it activates all these kind of go online. And this kind of goes offline. So you're not able to logic or rationalize it out. You just feel what's happening in your body. And sometimes people will get nauseous, or sometimes just a tightness or constriction. Sometimes they have like tingling sensations.
Could they have a panic? Like feel like they're having a panic?
Yeah, I've had people that would have one of those. However, there's dual attunement going on. So if I'm co-regulated, if I'm calm and my nervous system is down, basically that helps you feel like you're in a safe place.
You're grounding the person.
I'm grounding the person. It's very energetic, woo-woo, kind of when you think of it that way. But we're always co-regulating. So mom and child co-regulate at birth, right? Oxytocin gets released from mom and the baby can feel that.
So the spot that they're looking at, is that are you trying to find an uncomfortable spot?
Not always. Okay. So it could be an activation. That's what we call the discomfort spot. Okay. Could be an activation, but it can also be a resource spot is like the calm, peaceful place. But there's also these expansion spots, like connecting with whatever you believe is your higher power, God spot, or connecting with grandma that was your calm spot when you were a child. So I can activate all of these different spots at the same time too. So the person could go from like their activation spot to their higher power spot to their resource. But the person can also, like, if someone has a lot of trauma, them being able to have the choice of when and how and where they go with their eyes, that in itself is very healing. So sometimes it's just about them having the choice because your brain leads you. That's called the tail of the comet, where the brain is leading the person into their own healing.
How is trauma and emotional pain stored in the body?
When there's trauma that happens, this part of your brain shuts off. So if you think of, let's say there's a bear in the corner. You want to be able to act really fast. And if you start thinking, well, I could do this or this or this, you're going to end up getting eaten, basically. Yeah. So, and then if we think of like cavemen, they didn't even have a prefrontal cortex. They weren't big thinkers. And they had to act fast to survive. So if the caveman, this is usually how I tell my youth clients, if they were to leave the cave and a saber-toothed tiger comes running at them, they're going to fight the tiger and have some dinner. They're going to get the heck out of there before they become dinner. Or they're going to freeze up and their body releases oxytocin so they don't feel it when they get eaten. Or fawning has been thrown in as a trauma response, and fawning is basically people-pleasing. Now, trauma is just a threat. Yeah. It's a threat to ourselves, threat to someone we love, or attachment trauma. A lot of people don't like to talk about that because they feel like it's laying the blame. But as a baby, as a child, your survival depends on your caregiver. And part of that is also getting your needs met with attachment. So if mom has postpartum depression, not her fault, but it still causes an effect in the baby. If there's a lot of fighting, even a lot of moves or bullying or something that happens in those primary developmental stages, it signals to the brain that there's a threat. So in the time of threat, what happens is all these parts of the subcortical brain turn on and neuropeptides are released into the body, as well as stress hormones like cortisol and adrenaline. And when that happens, basically it's going to store. So it's going to store these new wiring in the brain as well as the body, because what happens is the brain wants to remember this as a threat for future. So basically, that caveman wants to remember the sound of a growl or the look of the cat in order to survive in the future if he hears that growl. Mm-hmm. Because the body doesn't remember things like the front of the brain does. It remembers things through the five senses, which is why a song can make you think of grandma, or a sound can trigger a startle response. All those things can activate your subcortical brain that there's a threat happening, even if it's not real. Like soldiers that go to Afghanistan and there's gunfire. come home, walking down the street with their wife, and a car backfires. It's not a threat, but the sound triggers that response of, I don't know, punching the guy next to you, or throwing your wife down, jumping on her to save her, or freezing up, or starting to run away. So all these things can happen.
So it triggers survival.
Survival, yeah, which we're meant to have. But the problem is if it's, just a tiny little spider and I start screaming and bashing something, it's probably a little bit more than I need to be doing, right?
Yeah.
So that's when we want to work on it.
Why would traditional talk therapy not be able to address, say, a phobia or, a response, as you said, like a husband laying on top of his wife to protect from gunfire? Why wouldn't talk therapy fix that?
So I'm kind of a little controversial in the whole talk therapy thing because it just is crap. And I know I'm not supposed to really talk about it like that, but I have had so many clients come to me that have gone through years and years and years of therapy and it hasn't done anything for them. Because what you're doing when you go and talk about it, I said, like the prefrontal cortex is speech and language. So you're getting out of your subcortical brain where all the threats are, where the trauma is, where the response is, and you're trying to logic it out. And sometimes people will say, it makes no sense to me why I do this because rationally I know I shouldn't be anxious about spiders, but I am. Because it's not about logic, it's not about this part of the brain. And when you're talking, you're just going through a cycle. Trauma isn't about the story, but you're telling the story, so really you're triggering yourself rather than completing the cycle of the processing, the feeling, the body.
Yeah. So I'm really curious about your opinion on CBT training.
So cognitive behavioral therapy, it's kind of like the dinosaur of psychotherapy. And it does have a foundation piece because our thoughts result in our feelings and those can create behaviors, kind of, but it leaves out the whole nervous system and the body. And the problem is when we're thinking about the past, like if you were to go back 5-10 years ago, you're either going to have something you did that you regret, something someone else did you resent, or you're going to long for a happier time. So you end up feeling sad. And if you go to the future, you either have hope, things are going to get better, excitement, I have kids, Christmas is coming, or you're going to end up being afraid because you don't know what's coming. So in the past, nothing can be changed. In the future, we don't know what's happening. So it does have premise in that. However, it leaves out the fact that sometimes we behave certain ways without making any sense of it. So cognitive behavioral therapy has its place. It can be good for short-term kind of the ability to learn to connect your thoughts to your feelings.
Yeah.
But really, if you have trauma, don't do CBT because it's not going to work.
I have to agree with that.
Yeah.
Because just a little bit about my experience with CBT. When I was diagnosed with anxiety, I had a whole chapter of my life when I had my children were very young, where my anxiety was so heightened. And I couldn't really drive a car. Okay, I would have an anxiety attack if I was in traffic. Right. And CBT training would tell me to expose myself to that fear.
Yeah.
And I remember one day I had it in my head, not that like any therapist told me, get in your car and drive and be scared. No one said that to me, but in my head, I had to face the fear. It wasn't a rational fear. And I almost got into a really bad car accident one day.
I don't doubt it.
And that's when I realized that CBT training was not suitable for my recovery.
One of the things that I teach people is that there's anxiety and other emotions like sadness, jealousy. We're meant to have all those. But each one of them has a message. And that's what we need in the moment. And then there's trauma. And trauma is the stored threat from before. And CBT is not going to help with trauma. It will help with those emotions and how to control them better. But the first thing that someone who's recommending therapy or looking for a therapist should do is figure out if what's happening is trauma, like a threat, or is it an emotion? Because if it's an emotion, they can learn coping strategies, but coping strategies are not going to work for trauma.
So typically for a talk therapy session, you'd walk in, sit down, and talk.
Right.
What would a brain spotting session look like?
So for a brain spotting session, I do all mine on virtual, first of all, but for a brain spotting, it would basically be, now I always do my own thing. So I always do like highs and lows for your past week. And then that also can sometimes help if they don't know what they want to work on. But then we would basically start with a session if we're continuing from last session or not, and I would ask you what you want to work on, and then we would either activate or find a resource spot. And basically I would have you find a spot to look and hold that spot, and you would begin processing.
What would a typical client look like when they were going through, when you found the spot that you want to look at?
So there's no actual typical client. So sometimes people will yawn a lot, sometimes they actually burp.
Really?
Yeah.
Interesting.
Oh, sorry. Sometimes they will twitch. I've had a lot of people that will twitch a little bit, lick their lips, or trying to think of what else they might do. They fidget, cry, laugh, get kind of tense. Yeah.
And how long would that last for?
It could last 5 minutes or 2 minutes. It could last for like 40 minutes. So I often will ask them how activated they are out of 10, but not always. And sometimes I integrate other forms of therapy into it, depending. I kind of follow my intuition on that one, but
Yeah, once you get to know your client, you kind of know how to lead them through it.
Yeah.
Right? So
Right.
It's cool. The eye position, they'd look, and then
so your eyes are connected to your optic nerve, and your optic nerve is connected to your subcortical brain.
Okay.
So that's how you get sensory connections or felt sense. It's your implicit memory, so images, right? Mm-hmm. So by connecting to that part of the brain, that's how you can activate your brain-body connection better.
Okay. So from what you see, as you said, you see them twitch. Would that be connected to what they're feeling emotionally or physically? How would they feel that in their body?
Well, I'm always asking, what are you noticing in your body? What are
Okay.
you feeling? And yes, usually it's connected. I'm kind of energetic as well, so I've noticed different areas of the body can kind of come up with different issues. But usually it's because your body stores memory through the 5 senses. So it's kind of activating whatever's been held and stored in your body at the same time through various parts of the limbic system of your brain.
Interesting. If someone was in a brain spot and all of a sudden they were feeling back pain, what would that tell you?
Well, that would kind of go into my whole energy thing. So with brain spotting, the correct answer as a brain spotting practitioner would be that would just tell me that that's where they've stored that kind of thing, and to follow them with the tail of the comet where they need to go. In my back of my brain, I kind of process that as, like, let's say they have pain in their stomach or nausea. I've kind of connected that to like daddy issues. That's not the technical term, of course, but the chest tends to be like a connection with something with mom. So I've just kind of, in the back of my head, kind of connected those pieces.
Cool.
So, yeah.
Interesting. So what would you say to people who believe that your brain and your stomach operate together? So, for example, somebody who has a lot of IBS issues.
Right.
I've heard and read real studies that show that brain spotting helps heal gut issues.
Yeah.
What do you say to that?
That's fascinating, isn't it? So our brain, first of all, we're just discovering how much power it is. And everything is connected. So I describe it as energy, but basically when you're thinking something, you're firing neurotransmitters. And those are connecting to the emotion, which is firing hormones into the body. So neuropeptides and neurotransmitters and hormones, they all kind of move into the body, I think, through the brainstem or the blood. And basically they store. So they'll attach to your organs, your muscles, your bones. And over time, the more stress or the more activated you are, the more those will attach. So that is why they're finding different conditions are related to trauma or stress. You think of your brain producing cortisol and activating it in your body for years. I mean, they've directly connected like some kinds of careers like nursing, high stress, to like cancer diagnoses, and chronic pain to trauma, and IBS to trauma, and even I had polycystic ovary syndrome. That is connected to trauma. Now, saying that, I do have to say the little blurb that it's not always, right?
Yeah, yeah.
But, I mean, as a trauma therapist, I think it always is. So there's also that piece.
Yeah.
And so when I'm doing a brain spot with someone and they're releasing whatever's been held in their brain, they're also processing whatever's been stored in their body. So they may have their stomach get activated, but over time, it may also help it process so that they no longer have those symptoms.
And it also seems to me that there's two immune systems,
Right.
so to speak. I'll try to explain this properly. So we have the immune system that will fight off a virus. And it sounds kind of like our nervous system fights off its own types of viruses, right? Am I on to something?
Kind of. Yeah, I would say it's more nervous systems, but yeah, exactly. Or vagus nerves, which move through your body. I rarely get sick. Like, even with my kids having croup right now, or strep throat, or my husband gets these horrible sinus infections, and I used to. I think maybe once every 2 years I get sick now, and I work in the school system, so it's pretty spectacular.
Yeah, so it just seems like they're both of the systems really are connected and do work together, and both need to be optimal, right, to have optimal health. And a lot of our medical system focuses only on one. Right.
The way it was explained to me recently is that for a physician or for the medical whatever field, they are taught to heal people from the symptoms, not from the foundation, the cause, or everything else.
Yeah.
So they just take, if someone comes in with, I don't know, IBS, let's give you this, right? Instead of, well, when did this start and how did it start? And, you know, tell me about your childhood. I used to specialize with people with borderline personality disorder. I had some clients that would come to me after taking dialectical behavioral therapy 6 or 7 times.
What's that?
Dialectical behavioral therapy, you can think of it as like cognitive behavioral therapy, but on steroids. So it's all about distress tolerance. And it teaches you how to cope with your thoughts and feelings and behaviors. Very structured. So there's like a lot of acronyms, but acronyms with like actual strategies on how to heal and cope with different things. But 6 or 7 times taking a class or a course like that on how to cope and you're still not coping, there's something serious there. And one of my clients had come to me after taking it, I think 7 times, and nobody had ever asked her how her parents got along or what it was like growing up in her house, ever. They had just dealt with the trauma that she had most recently had. So,
interesting.
Yeah.
I guess that's all they were really trained to do, right?
Yeah.
That's why it's so important to keep an open mind.
Right. Yeah.
Very, very important. So whenever you do brain spotting sessions with your clients, what kind of breakthroughs do you see? Like maybe short term or even long term? Like how long does it take for an individual to see the results?
Right. So this is why I actually, also with my ADHD, but this is why I kind of ran with brain spotting when I first took it. So I took phase 1 and then right away took phase 2 because of the miraculous changes that I saw. One of my earlier clients with brain spotting, I'll try to go into it without going too much into it because I don't want to give away any confidentiality piece, but chronic suicide to the point where they were attempting once a week, at least. One session with brain spotting where they left still activated or like they never got to a 0. So I thought it didn't work because I had been in training and we were supposed to get them to a 0. Yeah. They left and I thought it hadn't worked. And then I saw them 3 weeks later and they said, well, actually they had been admitted to a hospital because they had started reaching out for support instead of making the attempt. So I thought, oh, wow, that's pretty cool. And then within the next month, they lost probably their closest mentor to suicide. And I thought, oh my God, I'm gonna lose a client. And I didn't see them. And then about 6 months later, they came to visit me and said, no, actually, they were doing so well that they had picked a university, were going away, had gotten a new psychologist, and everything was going really well in their life. So I was like, wow. And so from there, I took part 4. I took expansion, which I will get into, neurodivergency and brain spotting, attachment and brains, and so much more, because it's miraculous.
Yeah. So it sounds like it could be like almost like someone who had done a brain spot can be activated for quite some time. And heal over longer periods.
Like after the session's done, you can have dreams, you can get really, really tired. When I do expansion brain spotting, that can be different, but you can have like a brain fog for a few days, because the wires that we've kind of supported shifting continue to shift, right? The trauma didn't take overnight to kind of seal in.
Right.
So it takes a few days sometimes to release.
Yeah. This therapy almost makes people connect with themselves in a completely different way.
Yes. Right. So it's all about connection. And that's why I also use it in coaching, because expansion brain spotting is all about making something bigger. So you can people will use it for like acting. What did I do? One person used it for like doing a pull-up over a bar at a gym. They couldn't do it. So one brain spot, they went home and were able to do it. Basketball, shooting hoops, I've done it with that. I've done it with people that want to find their purpose or connect with passion, guitar playing, even spiritual stuff. I've helped people kind of connect with that in order to make it bigger. So expansion brain spotting, you find a spot that like connects with whatever you're passionate about, or your sense of purpose. You're lost in life, you don't know where to go, and you focus on that spot. And people have walked out and returned to say, I don't think I need your sessions anymore. And I'm like, I love discharging. So
What would you say is the biggest misconception about well, I don't even know how to say this question properly, because I find a lot of people don't know what brain spotting is, but for therapists, I guess, if you're talking to a fellow therapist, what would be the biggest misconception about brain spotting?
That's an interesting question. I think I'm so passionate about it, it's hard to consider. Because if people are skeptic as other therapists, I'm just like, well, you keep pushing your CBT and you're going to get nowhere. Yeah. But I guess the biggest misconception would be that it won't work, because it's too woo-woo, or it's too led by the clients, right? Where traditionally psychotherapy was supposed to be, how do you feel about that? And let's kind of look into that deeper. But however, I've done training with people from the States, and it is the go-to for their soldiers and veterans.
Really?
When I'm working with a client with trauma and they come to me with like a car accident, 3 sessions sometimes. Complex trauma, I just had a client for 8 sessions. Now she won't let me say she's discharged, but she basically is, right? So it can be amazing how otherwise, like some of those people, I know a colleague of mine that does EMDR, and she's had people for like 3 years. Like, I don't want to work with you for 3 years. I want you to heal and go so that I can help more people.
Yeah.
So,
I'm, with my therapist, I'm a once a year bulk session. Yeah. So I'll do once a week, 4 weeks back to back.
Oh.
And then we don't know if we're actually going to brain spot or not. We see how it goes. Mm-hmm. So I can brain spot for just 10 minutes and it could change my life. So it's ADHD. Pretty cool. Yeah, and it's always right here. And it feels like I have water in my nose. I cry. I'm a crier. Yeah. And like my eyes water like nuts. And it's just like all this pressure comes out of my head. It's crazy. I hold all my stress in my jaw. And then I do once every 2 weeks. And then I'll know the session when I'm like, okay.
Yeah.
I'm good. And then she won't hear from me until I'm like, okay, I really need to.
ADHD and brain spotting, I have noticed, and myself, it's very, very fast.
Oh, it's amazing.
Like sometimes it's like 30 seconds to a few minutes with my youth. And they're like, I'm done.
It's like it scratches this itch. Like I can't even describe it. It's like this itch that you have, this irritation somewhere. And you sit down and you do a brain spot and it's gone. Like my therapist has told me I can do those ones on my own.
Yeah.
And sometimes, but for me to create that space for myself, like in my own head, is very difficult.
You need the binaural.
Yeah, I'll just
stimulation.
like lay down, run the water in a bath, and shut my eyes. And I have to shut my eyes and find an uncomfortable spot, and then I'm good. And then I'll cry and I'll be like, I don't know what that was about, but I feel amazing. And then I can actually focus better, and I'm not so bitchy and all that fun stuff.
Impulsive anger.
So, say that someone's listening to this podcast right now and is a little skeptical about brain spotting. What would you say to them?
Well, you can keep doing cognitive behavioral therapy, or you can do something new that might work. And by new, it's not that new. It's like over 20 years, I think, now. Everything is energy, so everything is connected. Our thoughts are connected to our emotion is connected to our body. Everything is connected. And if there is a modality out there that you're hearing people are changing so fast, why not try it? So, yeah. I'm a neuroscience geek. I've always had to know how things work in order to accept them. So, and it has such a basis in spirituality too. So, yeah. And then if you integrate internal family systems with it, it's like amazing. So,
what does brain spotting look like for children?
Oh, so my daughter, when she first did it, it was a puppet. So basically what they did, I'll tell Myra's story. So Myra was born at 24 weeks. She was 1.5 pounds. So very traumatic for me too, but really for her. And what happened was the brain spotter held this little puppet. And we had this story that we already told about, it's about an owl hat, but basically we had a story that we already told about her birth in order to help her process how early she was. So what they did was hold the puppet, and she looked at the puppet when I told the story. Because as parents and at that age, because she was 3 or 4, they're not separated from us yet. And then she was able to, it was very fast, and I didn't really think it worked, to be honest, but it did. But as children, as they grow, it can become more music. So with the bilateral stimulation music, it can be more effective. And I'm thinking about her again. We did from her trauma growing up, she had to go to the hospital all the time and get like oxygen masks because she couldn't breathe properly. And she had to go for this, I think it was an MRI or something, but she was feeling very anxious about it. And it would be her screaming and kicking at doctors even. So I did a brain spot with her, and she said, I don't want Daddy to hold the mask on my face. And it made no sense logically because there was no mask happening. But that's the core memory that was surfacing for her. So again, it's just them finding a spot and looking, but it can be so much faster. Even with my youth clients, I have a lot of them that ask for brain spotting because it's changed their life so much, and it can be very, very fast.
Have you ever heard of sand play?
Yeah, people keep bringing that up. I'm interested in getting a box. I've never actually done any training or even seen it, but I hear that it's very effective.
Yeah, it was actually recommended to me through my psychotherapist, where anytime that my daughter had a hard time, because my husband was away a lot in the military, and that really was hard on her. Yeah. And she also experienced one of her core people pass away at a very young age, her grandfather. They were very close, and he passed away. And during that time, my therapist said, get a sandbox with toys, but the toys are like little figurines, but the figurines can't be associated like Bluey or, I was thinking of Frozen. Like they have to be like just
separate.
Yeah, that's nothing that they can relate to in that sense. Okay. And then she just said to ask her to show me your world. And you just sit there and you let them play. And through play, they process.
Yeah.
Very cool. Very, very cool. So I find that even brain spotting for children is an easier way. Because you can try to get a kid to talk about something that happened to them. They can't, they know how they feel. And then this way, I guess it just lets it all out.
Yeah. Yeah.
It's really cool.
Yeah.
So you mentioned that you do therapy with addictions.
Yes.
Do you find that brain spotting benefits
Yes.
addiction patients, or sorry, clients?
Yes. So I did the training with Dr. Roby Abels. Anyway, it was fabulous. And she does it, it's called the crocodile setup. I will say that crocodiles are pretty scary, right?
Absolutely. They're dinosaurs.
They're even scarier in Australia. So anyway, she tells this fabulous story about the crocodiles and how we need to watch out for them. And then she kind of uses it as an analogy for addictions. Okay. Because your recovery is what you're protecting, and the crocodiles are what are sitting around you. So how close are your crocodiles, your triggers, your cravings? Where are they at all times? And then the brain spotting, there's 2 sessions, and the first one is kind of finding a consequence spot and a use spot. And then the next session is a freedom from. So what happens is fascinating work. So when I did the practicum with her, the person that was being activated, I can say activated, into their use, they actually felt like they were high, and they had been using cocaine when they were using. Yeah.
In that session?
In that session, they felt like they were high, but they would go from that to the other spot where they were activated with the negative kind of consequence of use. And
wow, that's
heavy. It was heavy. It was fascinating, though. And then because it was a practicum, the next day they did the freedom from, and they realized that they wanted to move. So they messaged me like 6 months later and told me that they had actually moved across the country to where they wanted to be. Now, they had been sober for years, but it was just that act of the brain spotting that did it. I kind of got off topic there, but one of the first clients that I used brain spotting for addictions with had been an alcoholic for years. And I did the brain spotting for addictions with him. And from that, he quit drinking, went into recovery, and remained sober for 6 months, had a small slip, and then I think it's been 2 years now. And he had literally tried almost everything, too.
What do you think of clinics now that are using brain spotting that also use substances like MDMA or ketamine to access certain parts of the brain with brain spotting?
So it's becoming more and more popular. I was recently, actually, someone reached out to me asking if I would do ketamine-assisted psychotherapy. So 2 things come to me when you ask that. The first is the amount of people that are like ayahuasca or just doing some magic mushrooms without the psychotherapy piece. It's very important to have integration when you're doing those kind of assisted DMT kind of activation. But what I will say is that we can also get there through breath work, and brain spotting can sometimes activate that part of the brain. So using it with brain spotting, I mean, honestly, you can use brain spotting with everything. So I'm not going to turn that down. But I think you have to be very, very cautious about doing those kind of, especially chemically assisted therapies. But also, we're learning so much more and more. And I did my own retreat, actually, that was cannabis psychedelic assisted. So it was fascinating. I also learned that I'm pretty good. But, but I will say that when you're really, really stuck, the way to access those different parts of the brain that are kind of hidden, it has this ability to help get there. And I will say that place that I went to, that retreat, they're actually being trained in brain spotting. So there's something to it. I just don't know enough about it to really speak too heavily on it.
For anyone curious but nervous about trying brain spotting, what's one thing that you want them to know?
Everything is connected. Everything is energy. Everything is science. And brain spotting can activate literally all of it. So if you feel stuck, if you have nightmares, if you're confused, if you're lost, brain spotting can help you get through it, right? I'm doing a group brain spotting actually with people with anxiety right now. So that basically we find a spot during the group session and they are able to process whatever's being held in a group. So there's that co-regulation too. If you want to heal, brain spotting can do it.
And for you as a therapist, what has bringing this tool into your tool belt pretty much done for you as a therapist?
It has expanded my practice to where I wanted it to be, is the short answer. The long answer is I'm able to help so many more people because I no longer have people for a year or 2 years. It's like 8 sessions and then they can move on. Sometimes they stay, but that's because more issues will come up or they just really like to have sessions. Yeah. So there's those ones too, but 3 to 8 sessions for a main trauma, that's amazing.
So what does true healing mean to you after witnessing it firsthand so many times?
Oh, I love that question. Connection. True healing is connecting. Connecting with ourselves, connecting with others, connecting with a higher source or power. It's connection. I got to tell a story about a client I had. They were like atheist and like, so I don't want to talk about God. I'm not connected in any way, shape, or form. And they left my service as that as well. But they're, like when I asked them what mindfulness meant, being present in the present. I'm like, so, and I use that every time I talk about mindfulness. They were literally one of the most connected individuals that I've ever met, and yet just didn't want to see it. So connection is everything. Yeah.
And if any of our listeners wanted to get a hold of you or just reach out, follow you in your journeys, where can they?
So Instagram, Manifestation Therapy, no break. Facebook is Manifestation Therapy 23, I think. My website is manifestationtherapy.com. I'm a coach. I'm a clinical social worker. Reach out and let's get some work done.
And I just want to say thank you so much for pretty much making the world a better place. Because that's really what healing does too. It makes everybody just happier all around, right? So thank you for the really amazing work you're doing. And I look forward to maybe doing another episode with you.
Me too. Well, thanks for having me on, Brittany.